Welcome to this 5-minute OET video. This is one of a number of OET videos and it's designed to help you get the score you want in this exam. All of these videos are designed to be short and simple to understand, and I hope you enjoy them. This video is for people preparing for the nursing exam and it concentrates on the speaking task. More specifically, this video teaches you some language that you can use to reassure a worried patient. Before we begin the lesson, I'll just explain a little bit about OET speaking. In this part of the exam, you participate in 2 role plays with an interlocutor. That's the name of the person you're speaking to. This person doesn't mark your speaking. You have 5 minutes for each role play, and it's a good idea to use all of that time. Now, back to the topic of this video. In many OET speaking tasks, the interlocutor plays the part of a worried patient. Therefore, you might have to reassure them in some way that they are going to be okay. At this point, I should mention that reassure means say or do something to remove someone's doubts or worries. Shall we look at this role card now? It's from the official OET website, and in this role play, the patient has been told by their doctor to start insulin injections. As we can see, the patient is worried that they will not be able to inject themselves. So your task here is to make the patient feel more comfortable about this unpleasant situation. How can we do this? Firstly, it's important that you shouldn't be too emotional, like, "Oh, I'm so sorry about this, please don't worry." Believe it or not, that's how some people speak in the exam, and it doesn't sound professional, does it? With that in mind, let's look at some useful, reassuring phrases that you can use for your speaking tasks. Example 1 is simple but effective. When we get used to something, it means that we become familiar or comfortable with something, so that it is no longer unusual or surprising. If you use a verb after this phrase, remember it should be an ing verb. The phrase that I'm highlighting here could be used in several OET situations. For example, you have a patient who has to follow a strict low-fat diet. You could say, "It might be difficult at first, but I'm sure you'll get used to your new diet." Or perhaps you have a patient who has to take a drug and the patient is worried about the side effects. In this case, you could say, "Taking this medication might be difficult at first, but I'm sure the side effects will wear off." Example number 2 is also simple, but effective. I've used the words "in time", and this is a suitable phrase to use because it doesn't mean in a long time or in a short time. So if we use this phrase, we won't scare the patient, and at the same time, we won't suggest that the problem will go away soon. That might not be true. Daunting is an adjective that basically means very worrying. We use it to describe a situation or task which makes us nervous because we don't believe we can do it well. For instance, "I have a daunting job interview tomorrow." We are now coming to the end of this video. I hope it's been enjoyable and useful for you. And do take a note of the key language from this lesson, which is on the screen. I'd like to remind you that if you have to give reassurance to a patient in an OET speaking exam, give them good news, but don't be too emotional. This video is part of the 5-minute Exam English channel. I invite you to check out more videos and subscribe as well. See you soon.